Alright, so we've just got Daniel here. He's the director from Physio in Brunswick. He's going to be running through a couple of exercises and tips today on shoulder health, and he's just going to give us a bit of an overview of what he does at Physio in Brunswick.
Hi, I've just recently taken over the clinic, and we're a multi-base clinic located on Brunswick Street in Fortitude Valley. So we offer services like Pilates, massage and mainly physiotherapy. What we do there, we assess clients for injuries or whatever they need. We treat them if need be, and if they need massage or ongoing treatment in terms of Pilates for strengthening and rehab, we offer those services too.
Yeah, so Daniel's the one that I normally refer all my clients to if they have any problems of that nature.
Okay, so recently in my clinic I've seen a lot of clients come with shoulder injuries and pathologies. I'm quite passionate about shoulder problems as I'm nursing one myself in my left shoulder. I have a lot of instability there, and so what happened with me was I was overtraining the wrong muscles and they were pulling me into the wrong position, and I got a few problems like a bursitis and impingement. I've overcome those issues with some physiotherapy and massage, but the main thing that keeps me going and keeping me pain-free and helping my training is the stability muscle training that I do on the side of my PT with Cody. A lot of problems occur in the shoulder when the top of the shoulder joint squashes against the bone of the arm as it comes up. There's a lot of muscles and cartilage in there that gets damaged, and so the idea of the training is to set your shoulders so that you keep that space in there, so when you raise your arm it's not compressing all the muscles all in between. I'm going to demonstrate some positions with Cody with his shoulder and what's a good position for the shoulder to do an exercise versus a bad position. Cody, can I get you to turn around, grab onto the bar and do a pull-up as you normally would? And slowly down. And one more for me. And slowly down. And all done. So what Cody did there was before he actually pulled his body up, there was a slight movement of these shoulder blades pulling down and inwards as he pulled up. And so what he did there, he stabilized his shoulder against his thoracic cage, so when he did the pull-up, the action didn't cause any damage or any abnormal movements in the shoulder joint. Now I'm going to ask Cody to not do that for this one, and you can see the difference. That's it, and down again, one more. And so what you see there, Cody's already raised his shoulders. When he does that, there is no more room for that arm to come up, so when he does the pull-up, it's closing down that gap in his shoulder and it's compressing all the tissues in between, and that's what causes the damage and the pain, and that's why people come in to see physio to seek what's happening, how to fix it, how to prevent it. One limitation why people can't get their shoulders back and down is usually because of upper back stiffness. A lot of office workers will sit at a computer in a curved position, and with so many hours of the day and doing that so many days a week, slowly they're getting stiff and stuck in that position. A good exercise to break that up is actually using one of these foam rollers and rolling the upper back from about under the shoulder blades to the top of the back or the bottom of the neck, and repeatedly rolling over until some of those joints separate and loosen off. Cody's going to give us an example. So what he's doing there is rolling over the roller, and gravity is pulling his back over that roll so that it is breaking up some of that stiffness that accumulates in the upper spine. And this will allow him to have good shoulder mobility and the ability to actually set them a little bit better. Okay, so one of the biggest culprits for shoulder pathology is an exercise that pushes upwards. Usually what happens there is the body recruits the wrong muscles, upper traps and levator scap predominantly, to do the exercise, and what that does, it compresses that shoulder space. So we're going to go through a few exercises of how it's supposed to be done versus how it's not supposed to be done, and ways to try to correct that. Cody's going to demonstrate with the barbell shoulder press. Correct. So the correct posture, Cody is setting his shoulders, chin back before he does the push movement, and it stays in the same position when he comes down. And just once more, Cody, and gently down. When you're struggling, if the weight is too heavy or you're fatigued or you're going too fast, you can adopt the wrong postures, and Cody's going to adopt a few of those for you. So what happens, the chin comes forward, everything's tucked in, shoulders round forward as he pushes upwards. What you can see with the shoulder, is that it comes up and inwards. That position is not a safe position for the shoulder to be in to do exercises, especially over your head and or with weight. So what Cody needs to do is use the back muscles through here to squeeze them inwards, as well as the bottom muscles here to pull them downwards to create space in that shoulder. Once more for me. Good stuff. I'm just going to point out some of the important muscle groups that control the shoulder. The big ones and important ones that we need are the lats, which sit underneath the shoulder blade, and they pull downwards. And you also have lower traps through here and the rhomboids. They all pull downwards and inwards. What the muscles that we don't want too strong are these upper trap muscles up here and the levator scap. What they do, if Cody wants to demonstrate again, they lift the shoulder. It's an important exercise, but you don't want that when you're doing too much upper body work. You also have small rotator cuff muscles which sit in and underneath the shoulder blade. You can't really see them too well because they are small, but their tendons wrap around the upper arm, and that controls the position of the ball joint in the shoulder, and they're also important to do. They're basically called the internal and external rotators. And on the other side, you have serratus anterior. It sits underneath the shoulder blade, and it has 3 fingers that come out around the front and join onto your rib cage, and they're also important ones to train. To also help keep good posture, good training and good muscle conditioning, myofascial release, massage, trigger pointing is really important for the muscles, especially of upper trap and levator scap. They're overused muscles, and stretching usually is not enough. So getting in there, breaking up the tissues, making sure they're not knotted up and sticking with each other allows better movement and recruitment of those muscles so that you can actually keep your form while doing shoulder exercises.
Awesome. Thanks for coming in, Daniel. If you ever need any physio treatment, massage or Pilates services, I highly recommend Daniel and his team at Physio in Brunswick. All the details of his website and contact details will be at the end of this video. Thanks again, Daniel.
Thank you, Cody.